Ready? So we're gonna go through the eye model. First, we're gonna start with the 6 extraocular eye muscles. So 4 of the muscles will have rectus in the name, which means straight from front to back. So the one on top of the eye, this is gonna be your superior rectus muscle. And then on the bottom, you have a muscle that goes straight to back here, which is gonna be your inferior rectus muscle. Now, you have 2 muscles here that are also rectus muscles, medial and lateral rectus. How do I tell which is which? The easiest way to tell is to go up to this muscle here that we just see sort of the tendon for. This is your superior oblique muscle. And it takes off and it goes towards the lateral rectus. So if I put this back, sorry about that. So if I put this back, this is gonna go towards the lateral. So then this is my lateral rectus, and this would be my medial rectus. And again, this was superior oblique. And on the bottom, I've also got an inferior oblique. And again, notice how it goes towards the lateral aspect. So whatever way it's running towards is lateral. This is the outer layer of the eye called the sclera, also known as the white of the eye. This is your clear protective covering over the front of the eye called the cornea. If I come around to the back, you can see my optic nerve here, which is going to plug into the back of the eye and supply it with vision. And again, that's cranial nerve number 2. So if I take this off, immediately you're going to see the middle tunic of the eye. So layers of the eye are called tunics. This is my middle tunic called the choroid, and this is the vascular layer of the eye that has all the blood vessels and nerve supply. If we look here at the colored portion of the eye, that's your iris, and the black dot in the middle is your pupil. If I now take this off, and I go inside to the pink area inside the eyeball, this is the innermost tunic called the retina, and we call this the receptive layer of the eye because this is the layer that has all of your rods and cones. So again, here's that optic nerve, and where it plugs in right here, that's called the optic disc. So where that inserts, that's known as the blind spot, aka the optic disc. Then if we look on the inside here, you're going to have this scalloped border out here. This is called your suspensory ligaments. And then this furrowed part right in here, this is called your ciliary body. And these are the muscles that attach to the lens and pull the lens into focus, making it more round. Now, this eye is missing a piece, but there should be a plastic or a glass disc that sits right in here. That would be your lens. This we're going to use to mimic the anterior chamber. So it goes from this line to the front of the eye. So sitting in place from this line to the cornea, that's my anterior chamber, and it would be filled with aqueous humor. So if I have this pinned here and I say, what chamber is this? You'd say anterior chamber. If I say what's in it, you'd say aqueous humor. I use the linus division, so then this posterior portion, anything from the line back, that's going to be called your posterior chamber, and it's filled with vitreous humor. I think that is pretty much it for that. Tapetum lucidum is not on the human eye.
Okay.
Yep, so not on the human eye, and I think we covered everything. The only thing you're not going to be able to see is the lacrimal duct. That will be on a picture, and that's the little gland that sits above the eye that produces tears. All right.